Thank you, Mr. Williams, and again, a pleasant good afternoon to everyone. This afternoon, September the 23rd, 2020, it's my task, as per usual, to share with you the Health Emergency Operating Centers Situation Report. The Federation of St. Kitts and Nevis would have reported a total of 19 confirmed cases of COVID-19. 17 of these cases would have recovered, and at present we only have 2 active cases. Let's now look at the Caribbean region. Within the CARICOM member states in the Caribbean region, the 206,784 confirmed cases of COVID. Almost 120,000 of these would have recovered, and the death toll continues to be quite low in the Caribbean region, and it stands at 3,902. Now let's look at some of these CARICOM member states a little more closely, and let's see what's happening in our sister islands. So in Anguilla, they would have confirmed or reported 3 cases, Montserrat 13, Grenada 24, Dominica 25, St. Lucia 27, St. Vincent and the Grenadines 64 cases confirmed, Antigua and Barbuda would have reported 96 confirmed cases, Barbados 189, and then the bigger territories, for example, Trinidad and Tobago, would have reported over 3,900 cases. Jamaica would have reported over 5,270 cases. So this just gives you a picture as to what's happening within the CARICOM member states. Yesterday, if any of us would have tuned into CNN, it was quite a bit of activity there in terms of noting that the United States of America would have passed the 200,000 mark in terms of total number of deaths attributed to COVID-19, and this occurred yesterday. Today, the death toll is 201,120 in the United States of America alone, with over 6 million, or rather almost 7 million confirmed cases in the United States. What's happening globally? Based on the data coming out of the World Health Organization, there are well over 31,375 persons confirmed with COVID-19 globally, and the global or international death toll stands at 966,399, almost 100,000. Almost 1 million, sorry. Now in St. Kitts and Nevis, a total of 2,205 persons have been tested so far. And again, we continue to accept our nationals who request to come home. To date, between April the 24th and present, a total of 407 nationals would have returned to the Federation. At present, we have 49 such persons in government-designated quarantine and 2 persons in isolation. Okay, so this afternoon, we would have received a flight. A flight would have come in, a charter would have come in from Miami with 116 persons for the Ross University School of Veterinary Medicine. In another couple of days, we are expecting another charter from San Juan with an additional 8 persons. And so this would be the 3rd batch of students coming into the Ross University School of Veterinary Medicine. And I just want to remind you of the procedure or the methodology that we are following. And so these students, they would have received their pre-arrival RT-PCR test in Miami. They would have been sampled on Monday. The results would have been returned, all negative, and then they would have arrived in country. They will be tested upon arrival, and so the Ministry of Health has a team on campus awaiting their arrival for testing. So they will receive a test upon arrival. They will go into compulsory quarantine for a total of 14 days on the RUSVM campus, and then on day 14 of quarantine they will be tested again, and it's only if they would have gotten back a negative RT-PCR test would they be officially discharged from quarantine and be allowed to integrate into the general population within the Federation. Okay, and so there was a media release, official media release coming out of the CARICOM Heads of Governments meeting on Friday, the 11th of September. And the heads of government of CARICOM, including our own Prime Minister, would have agreed in principle to a regional travel bubble. However, we must note that the country, our borders, the Federation's borders remain closed. And so the implementation date, as announced in that release, does not apply to the Federation because our borders are still closed. The CARICOM Heads of Government agreed to the recommendations made by the Caribbean Public Health Agency regarding how this Caribbean bubble or CARICOM bubble can and will operate. And so some of the eligibility, I'm sharing with you some of the eligibility criteria for countries to participate in this CARICOM bubble. To begin with, only those territories where there are no reported COVID-19 cases or those territories with low risk. In other words, meaning only those territories that meet this criteria whereby there is a COVID-19 case notification rate of less than 20 new cases per 100,000 population within the last 14-day period. So only territories in these categories will be eligible to be a part of this CARICOM bubble. And also the territories must have adequate quarantine and isolation sites for persons who are asymptomatic or mildly affected by COVID-19, and these facilities must be separate from the facilities that are designated for visitors and tourists. The islands must have adequate resources to treat severe and critical cases, and these islands must each have similar pre-arrival screening requirements and health screening procedures on arrival at the airports. And there must be a centralized posting or communication platform or website, national website, where anyone can find the requirements for the countries within the CARICOM bubble. So these are just some of the eligibility criteria for countries to be included in this CARICOM bubble. Travelers from countries within the bubble would be allowed entry into another territory within the bubble without being subjected to having a pre-arrival PCR test. Travelers from countries within the bubble would also be allowed entry without undergoing quarantine restrictions. So this is the whole purpose of creating this CARICOM bubble. However, travelers will be subjected to screening upon arrival in the particular territory within the bubble, the territory they are visiting. And please note that the travelers should have been resident in a bubble country or should not have traveled to a country outside the bubble for at least 14 to 21 days prior to the date of travel. So that's important. So in other words, you couldn't have come in from New York, a high-risk, hotspot, into one of the CARICOM countries that is included in the bubble under 14 days and be expected to move freely amongst within the other countries in the bubble. It was agreed that initially the following countries will be a part of this CARICOM bubble as they meet the criteria I would have described. And these territories include Antigua and Barbuda, Barbados, Dominica, Grenada, Montserrat, St. Kitts Nevis, St. Lucia, St. Vincent, and the Grenadines. However, it was confirmed that as at yesterday, September the 22nd, only 4 of these territories, and I'll name them, have commenced operating the travel bubble. In other words, these 4 territories, they have open borders, and so this CARICOM bubble has been operationalized in these 4 territories. And these 4 territories are Antigua and Barbuda, Barbados, Dominica, St. Vincent, and the Grenadines. And as I said before, our borders remain closed, and so our implementation date automatically is postponed because our borders remain closed. All right, and so I also want to talk a little bit about border security. And I'm thinking that this requires an all-of-society approach. That is, I think each and every one of us, we have a responsibility as individuals and collectively in terms of securing our borders. I don't think we can leave it up to the Coast Guard alone and the security forces. So if you live in the Connery area, the Keys area, Dieppe Bay area, Palmetto Point, Sandy Point, if 1 o'clock, 2 o'clock in the morning, you see a little tugboat coming on shore and occupied with potentially illegal immigrants, it's your responsibility to alert your neighbors, alert the community, alert the authorities. Because the last thing we want is for illegal immigrants from neighboring islands who may have been exposed to the virus coming ashore and integrating illegally into our communities and being responsible for an outbreak without our even knowing. And so we each have a responsibility as individuals and collectively in terms of securing our borders. Okay, I want to just remind us about the prevention and control measures. We can't repeat them enough. Wearing our face mask, and yes, it's very, very important because we now we have 2 active cases, but we are not sure if there aren't any more cases out there. And so you need to continue with the control and prevention and control measures so that you are actively and intentionally reducing your risk to the virus. And these include wearing of the face mask. We have seen pictures circulating of events whereby persons have been, attending functions, massive crowds, and individuals were without face masks. And so we all have a responsibility to wear our face mask when interacting with persons in public spaces. Hand hygiene is very important. Sanitation, very, very important. Schools are now open, so this is important even in the school setting. Physical distancing, maintaining an adequate space or distance of at least 1 meter, 3.3 feet between yourselves and others when in public spaces. Social distancing, social distancing, social distancing. I think we all have a responsibility to avoid massive crowds. Persons are, calling on, those of us in in positions to be held responsible for persons attending functions where there are massive crowds. And my position is that we all, as individuals and collectively, we have a responsibility to avoid massive crowds. We all have that responsibility. So let us remember the COVID-19 prevention and control measures that have brought us to this point. And these are the measures that to date we have to depend on, because we are still awaiting an effective treatment for COVID-19, and we are still awaiting a vaccine that is being proven to prevent this disease. Thank you.